Okay, so recording has started. I'm gonna share my screen with you guys. Okay, can you guys confirm that you can see the PowerPoint?
I can see it.
Okay,
Yeah, I
thank
can
you so
see
much.
it.
All right, so I'm gonna do slideshow just so you guys can see it. See it a little bigger. So we are not gonna be redoing our lectures. That's not the point. So I'm gonna be moving pretty quickly through the PowerPoints that we already, showed in the class. And then we're gonna do some review questions. But as I'm doing the review in the PowerPoints, I'm just gonna I just wanna quickly, point to those keywords or those important information that is gonna be very helpful, valuable for you guys to know for the exam. So we're going to start with neuroanatomy and psychopharmacology and sort of the major information that I need you to know. So know that disorders, psychiatric disorders are have a basis in genetics. So genetics plays a part. Also, know that environmental factors play a huge role. So there probably will be a question about genetics if it plays a role. Or maybe we're going to have a question that sort of gives you factors that are potentially affecting patients' mental health. So genetics will be one of them, environment will be one of them. As far as the brain structures, you don't need to be you don't need to know everything or the whole anatomy of the brain for the purpose of the exam. I do want you to know that amygdala is really it's our fear center, and it's very involved in any stress disorders, anxiety, depression, its involvement. Also, hypothalamus is involved. I also need you to remember that the frontal lobe, where the thought process is located, develops later. Is pretty much the last part of the brain that develops. That's why diseases that are related to any thought processes like schizophrenia are usually not diagnosed until later in life. I need you to understand, so be able to identify neurotransmitters that play important role in depression and anxiety. And the neurotransmitters that you need to know would be serotonin, dopamine, and then with stress responses, and it's epinephrine, norepinephrine, GABA. So make sure that you understand, just know the names of those neurotransmitters. Another thing that I need you to know for the exam is you don't need to know specific, mechanisms of action for each neurotransmitter, but I need you to know there's two ways in which neurotransmitters are destructed, because this is the way that our medications or my pharmacology is being focusing on, and this is how medications are working. So the first one, quickly to review, acetylcholine as an example, could be anything, could be serotonin. Acetylcholine is one of those neurotransmitters that when it's released and it sits in between the cells, so it's sitting in this gap, this presynaptic gap, it's getting destroyed by acetylcholinesterase. So if we make medications that block acetylcholinesterase, there won't be a neurotransmitter to destroy acetylcholine, and it's going to be more of that neurotransmitter in the presynaptic gap. So you don't have to remember acetylcholine or acetylcholinesterase, but just remember that the one way of action for medications this is the destruction of that neurotransmitter that's supposed to be inactivating that neurotransmitter that causes specific response. The other way of action is that reuptake of the neurotransmitter back into a presynaptic cell. So again, when we are acting on that reuptake, we're inhibiting that reuptake process, then there's more neurotransmitters left to bind to receptors in that presynaptic gap. And then understand there's two ways that we can have a deficiency or a disruption in normal process. When it comes to neurotransmitters, one, there's not enough neurotransmitter, or there's just enough or deficient receptors. So we don't have either enough receptors or there's some disruption. They're not maybe binding appropriately with neurotransmitter. So dopamine, norepinephrine, serotonin, we really did not talk much about histamine. So I don't want you to worry about studying histamine for the exam, just dopamine, norepinephrine, serotonin from this slide, and then gamma aminobutyric acid or GABA from this slide. We didn't really get into much detail of acetylcholine either, so you don't have to spend time worrying about acetylcholine. When it comes to antidepressants, I'd like you to know monoamine oxidase inhibitors, tricyclic antidepressants, SSRIs, and SNRIs. When we talk about anxiety agents, we're gonna do benzos and non-benzos, which Buspar is pretty much the only medication as an exemplar for a non-benzo anxiolytic. So that's quick review of that slide. Let me move another one into the spot. So after we talk about psychopharmacology, we talked about crisis. So let's take a look and see what is in the crisis slides that potentially could be an exam. If at any point you guys cannot hear me or cannot see something on the screen I'm talking about, just please speak up. I cannot see the chat. So if you guys, if there's something going on and you need to speak up, please speak up. Crisis, I want you to understand the characteristics of crisis. So crisis is different, so it's an experience that's different for everyone, but everybody experiences crisis. I don't want you to link crisis with mental disease. So healthy people can and often will experience crisis. It's not pathologic. So there's a question about pathologic processes, and crisis is one of those answers. Do not select crisis. It is disruption of equilibrium, and it usually is, it's severe, it comes on suddenly, but it's self-limiting most of the time. So I'm not going to ask you a question about this, this unlikely scenario when a crisis prolongs and lasts because maybe things were not put in place correctly. So just know that characteristics of crisis, it's self-limiting, comes on suddenly, it's severe, it's not pathologic, but it disrupts equilibrium. So we're not going to be getting in details, or I don't think there's a question about, crisis, what type of crisis. That's sort of, self-explanatory. We talked quite a bit about it. So, just know that there's different types of crisis or different events that can trigger it. If anything, if you might get in there was a question, maybe it would be a question asking, about the natural disaster or something that's happening that's truly, a very severe event that's happening either in a community or worldwide, and you'd have to classify or answer if this is a crisis. Which that's, for example, an example of environmental crisis when, for example, tornado hits. This is an important slide, and I need you to be very familiar with this one. So I need you to understand the steps, because this is we really have to follow those steps in order to achieve crisis resolution. So know those steps and be able to give examples. So most likely for the question on the exam, you will be given an example of some type of a behavior or intervention, and you're gonna have to classify, maybe, what would come next, or, is it something that is a, a process or a step in a crisis resolution pyramid. So it's called Roberts 7-stage model. You might have a question that says, after establishing rapport and rapidly establishing relationship, what would be the next intervention that the nurse would do? And the correct answer will be identify major problems. So know that on the bottom of it is plan and conduct crisis assessment, and then it truly focuses on safety. So if there's a question in the exam that says, you know, the nurse is responding to a crisis situation, what would be the first intervention that the nurse would do? And one of the answers is securing or making sure that the environment is secure and safe. That would be the correct answer. Or maybe part of that security and safety is that the patient, it's not an immediate danger, or patient is not, get patient to safety, or something that just tells you the highest priority. So pick the answer that shows you the highest priority intervention. Maybe the patient is not breathing, or the patient is, maybe just about to jump into a fire, or maybe there's a chemical spill around the patient. There's something around the environment. So the first thing, we're assessing safety. Then we are establishing rapport and rapidly establishing relationship. This is pretty much a classic example for that would be the nurse saying, I'm here to help. So it's offering support. So any type of behavior that nurses, I'm gonna be here with you and help you. I'm offering you my support. How can I help? This is that stage of the pyramid. We're just there to establish relationship. If we don't establish relationship, we're not gonna be able to move up that pyramid. The next step would be identifying major problems. So including the last straw or crisis precipitants. So this is sort of identifying what was the last trigger. We're not trying to ask the patient about their entire medical history, but we're trying to find out what was the last straw. So maybe the patient who has been sick for a long time, not now received a diagnosis of a terminal disease. So this is what we're finding out. What happened? What made you, what brought that crisis, or what made you feel that way? So identifying major problems. The next one will be dealing with feelings and emotions. So that includes, this is all of your typical nursing interventions that speak to this therapeutic communication. So here we're talking to the patient, actively listening. We're offering support as well, but it's more of that, dealing with patients' feelings and emotions. We're maybe reassuring the patient, or we're asking open-ended questions to find out feelings. If you have a question, about this specific part of the pyramid, there will be something in the question that will give you a clue that we're referring to patient's feelings or emotions. So how would be that different from the second step that when we talk about establishing rapport? That question about this level will purely be focusing on establishing relationships. So the nurse introduces herself, that establishing rapport. The nurse offers help. The nurse tells the patient that she will be caring for this patient at the bedside and will be here to help. Questions about dealing with emotions will be, the nurse validates patient's feeling of distress. The nurse recognizes that the patient has overwhelming emotions. Something that it will tell you something in the question that will direct you to the clue. There will be a clue, sort of. There will be a clue in a question to direct you to those feelings or emotions. Then generate and explore alternatives. This is when there's this dialogue between the nurse and the patient to see what are the options that we can offer patients to get the patient out of that crisis. So that would be offering, sort of depends what crisis, but let's say there's a question that patient, let's say the patient does receive, diagnosis of terminal illness. It might seem like there's no alternatives, but perhaps the question would be then, obviously the patient cannot choose alternative to not be sick. That's the choice that's sort of taken away from the patient. But the alternatives would be to ask, what would you like to do, or what are your plans, or what is the most important thing for you to accomplish? who do you need? Is there anybody that you would like to speak about your diagnosis? Do you want to notify anybody? What is the what is it that we can do that will bring you relief? Are there any parts or symptoms from the disease that we can address to help alleviate the pain? So this is sort of trying to figure, asking with the patient, what is there, what are the options? If it's something like, maybe the loss of housing, that's a little more straightforward, asking the patients, is there a relative that you can stay with? Do you have any other options or any support people that can offer you housing? Would you consider staying in at friend's house and assisted living, whatever the situation might be? If there's any conversation about options to resolve crisis, that would be that level. And then develop and formulate an action plan. So that's going to be more specific. So how is that different from generating and exploring alternatives? This is more of asking questions. So if you have a question about generate and explore alternatives, this is going to be a nurse, sort of negotiating the patient, asking questions, trying to get feedback from the patient. When you're in a stage of develop and formulate an action plan, one of the answers that will be correct or something will tell you there is a specific plan. So patient will discuss her diagnosis with her family and remain at their house, for as long as she's, able to. Or the patient will, stay at the hotel over the weekend until she's able to, move in with her sister who's getting her house ready for her. So this is specific. Development, formulate an action plan. That's going to have to be specific. And at this point, this is where crisis resolution should be happening, because we have a plan, action, we formulate and develop action plan. The rest of what is happening is follow-up plan and agreement. So this is when we're implementing the plan, and so the crisis kind of goes away. So this is when the nurse is going to be assisting the patient to move into a new location. This is when the nurse was going to be, educating the family, or maybe facilitating the conversation with the family about patient's recent diagnosis. And how the nurse is participating in the follow-up on that plan and agreement. So principles of crisis interventions are important. This is pretty much what I said on the first slide. So make sure that you know principles of crisis intervention. All of those are those characteristics. So safety issues, this is important too, because again, this is when you're looking at how you're going to help, what are the safety issues for a person experiencing crisis. Again, this is when it comes to the bottom of the pyramid. You're going to be seeing, is the patient at risk for self-harm or harm to others. ADLs, we talked again, this would be, is the patient eating? Is the patient drinking? Is the patient urinating? So basic needs, this is going back to that Maslow's pyramid, because again, patient could be at harm if, let's say, they haven't had anything to eat or drink for the last 3 or 4 days. Unable to function at work and relationships. So that could be a safety issue as well, if they're not able to function. It could be, relationship could be, the patient or abandon their child because they're not able to care for them. Insomnia, because again, sleep deprived patients, that's gonna not only that's just gonna increase the symptoms. Those patients could be in a lot of distress and then fear and anxiety. You don't have to memorize this, but just sort of know, and that kind of comes along, when we talked about stress, when we talked about anxiety, now we talk about crisis. If you start seeing patterns, we talk about depression too. So when you look at all of the mental health diagnoses, all of those they have similarities. There are factors that will put patients at high risk for all of those disorders we talked so far. So having another mental illness is really can contribute to putting patients in crisis, right? And having crisis, or having situations like crisis happening to the patient, definitely can trigger mental illness. Substance abuse, again, go both ways. History of poor coping skills, diminished cognitive abilities, any health, physical health concerns, no support or limited social support, and then any developmental or physical challenges. And then this is important in slide 2. I need you to know the differences of primary, secondary, and tertiary care. So rather than just memorizing definitions, try to see if it's some, you need to be able to understand or give examples of that. So that, the question is going to have an example of some type of an intervention, and you will have to select whether this is a primary, secondary, or tertiary intervention. So primary would be all of those things that you're gonna do to be prepared. So this is prior to crisis, is prior to the event. Secondary is your action. This is what you're doing to help the patient. And then tertiary, this is your follow-up. So crisis is gone. So you're gonna have something, look for those clues that tell you where you're at in the process. If there's something in the question that tells you the event has not happened yet, that is primary intervention. If there's something in the question tells you that patient's actively going through crisis, your interventions are going to be anything that you're going to do to this patient will be secondary intervention. And then if there's something in the question that tells you that the crisis is already passed, that is a tertiary intervention. So that's our crisis. I know I'm skipping quickly, but you guys have the ability to look through those slides. I just want to make sure we get some practice questions. So another, the next slide I want to pull up would be the trauma slide. So for trauma disorders, so signs and symptoms of trauma or stress, right? Just be able to identify that could show as insomnia, as overeating or not eating enough, tension, so muscle pain, tension, headaches, sort of withdrawal, or anger and aggression. And please review before the exam, review the reference article that's located in lecture for that particular class, and be able to identify what signs and symptoms, how actually stress, how sustained stress can affect your physical organs, your body system. So what are the effects of sustained and prolonged stress on cardiovascular system, or endocrine system, or muscular system, or respiratory system? All of that is really nicely and succinctly listed for you in that article. So please go back and look into that article. From this slide, I don't need you to, again, memorize all of those information, but I need you to know what is the difference between sympathetic and parasympathetic nervous system. So if your sympathetic nervous system is being activated, what response is your body's going to produce? Is it going to be elevated blood pressure? Is it going to be elevated heart rate? And what happens? And also, this, just knowing that this hypothalamus pituitary adrenal cortex is there's gonna be a release of cortisol. So you don't need to necessarily know all the details, but know that at any time the fight or flight response is initiated or it's triggered by some type of a stressor, your heart rate will go up, your respiratory will increase, your triglycerides are gonna go up, your platelets are gonna go up, your kidney clearance is gonna go down, your blood to skeletal muscles are gonna go up, and your muscle tension is gonna go up. In addition to that, there's gonna be release of cortisol that's gonna make you retain fluid. It's gonna produce or increase your glucose by gluconeogenesis, just because you need that extra sugar to be able to produce the energy to help you fight or flight when the trigger gets. So so this is pretty much all you need to remember. And that if you only want to remember, based on your comfort and knowledge with pathophysiology, for some of you, it might be enough to just remember that, memorize this little or know this little blue box. And then based on those reactions, you might be able to pretty much determine what type of effect it's going to have on any body system, right? So if you have increased platelet aggregation, increased triglycerides, and the heart rate's going up and blood pressure's going up, it probably puts you at high risk for cardiovascular disease. So again, all of those factors that contribute to heart disease are present. Respiratory rate going up, patients are higher risk for having respiratory concerns. So as far as PTSD, for PTSD, I would like you to know, I don't think we have it here listed, but I would like you to know that this PTSD is triggered by a traumatic event that's outside of a normal. So it's an external, some type of an external stimuli that's severe as a traumatic. Could be mentally traumatic, could be physically traumatic. We often think about veterans, but it doesn't have to be. So being able to identify PTSD and know the symptoms of PTSD. So if there's a question about patient being in distress and the patient is, experiencing that, flashbacks or, suicide, there will be something that's going to make you differentiate PTSD from other disease. So, if I'm going to ask a question about depression versus PTSD, I will give you something that signifies that this is PTSD, not depression. So there won't be any tricky questions. You should be able to clearly, as long as you know PTSD, which would be, again, flashbacks, insomnia, reliving the event, maybe amnesia, maybe patients are sort of rejecting this event. So some of those features of PTSD, and then so you're going to have a clue in there that is different than depression. Acute stress disorder, the only really thing that you need to know about it is and how it differs from PTSD. To me, sounds like a great question for the exam. Is it self-limiting? So PTSD is a disease or disorder that lasts. It just lasts most of the time, the lifetime. But acute stress syndrome is self-limiting, is usually about a month. And then be able to recognize secondary stress. So you might have a scenario that describes, a stress or reaction of a healthcare provider or a caregiver, and be able to identify what the secondary stress is. Secondary stress, know that it's not a burnout. It is indirect trauma. So it's trauma that happened to somebody you care about and you care for. So again, it could be your loved one, it could be a patient that you're caring for at work. So that's key points from trauma. And we have a couple more PowerPoints. So anxiety disorder PowerPoint, this is that's pretty lengthy. So I'm really gonna sort of just pick where I want to go with that. Know this slide. This is put a big star next to this slide because I want you to be able to know the difference between anxiety versus fear. Fear, other words, stressor, right? So, might not say fear, might say stressor. So it's a reaction to a specific danger. Fear is a reaction to something specific, when anxiety is an apprehension or, a dreading result from a real or perceived threat. Know this slide as well. So know what is occurring, what are the, again, it will be all of those sort of, you're gonna start seeing similarities. You will be able to, at the end of this course, you will be you will be able to identify patient, who has all those features that put the patient at higher risk for having mental disease, just because a lot of those factors are overlapping, and you sort of, I hope, start having a picture or seeing a picture in your mind of this person who, perhaps had a substance abuse, who have been exposed to some factors, maybe had a trauma, lack of social support. So all of those things, as they add up, will put the patient high risk for mental disease. Know the difference between normal, acute, and chronic anxiety. So that probably will show up on the exam. It's going to be a scenario just like we have those two, 3 case studies. So, and identify if this is an example of normal, acute, or chronic anxiety. Know what are healthy and unhealthy defense mechanisms. Know the ones that are intermediate that could be either good or bad, and be able to give an example. So I guess not necessarily being able to give an example because they're all going to be answered given for you, but think, are you able to identify like what type of an example would that be? So for all of those disorders from that list, panic disorder, phobias, any phobias, generalized anxiety disorder, obsessive compulsive disorder, and post-traumatic stress disorder, be able to identify key features. Because again, some of those disorders overlap, right? So there's some features that you will have patients, be able to identify with any of those disorders. But think that, so know all of those, but then think, okay, how would I describe patient with panic disorder versus somebody with social anxiety disorder? What would be the trigger? What would be the patient characteristics? So if I give you a scenario, be able to identify, which disorder. So be able to identify which disorder those symptoms go along with. And they're usually, they're always going to be something that will give you a clue. So again, it won't be like you have to just guess out of the, I'm not gonna pick all the symptoms that are identical to all those disorders because that's not fair. There's just no way to know to do it. So there will be something in the answer that, or in the question, that will give you a clue. If somebody's scared to go, have a CAT scan, this person might most likely have, claustrophobia, which is actually a very common concern with patients who have to go and have a CAT scan. Or if you have somebody who's, a nurse that's presenting is getting ready to present in a board meeting today, and she has some symptoms, probably she has social anxiety disorder. I need to get a picture of the spider out of here. For obsessive compulsive disorder, be able to, so the most important information here is just to make sure that all of those feelings or rituals or physical presentations are unwanted. So the patient has some, patient is being distressed because he had to count the towels 5 times before he left home. That's gonna be obsessive compulsive disorder. But you might have another answer that tells you that the patient, double checked if the stove is off a couple times. That's purposeful because, again, many of us do. So be able to there's gonna be something in the answer that's gonna make you think this is it's unwanted. It's not that the patient is just making a decision, I better double check that stove because I left it on in the past. Or maybe we just recently renovated our kitchen, so I double check that the water is turned off before going on vacation. So here there's no reason. It's not patient's decision. It's the decision is taken away from the patient. It's unwanted. I'm gonna move this out. I'm gonna stop sharing my screen. Oh, let's turn some light on. All right, so we're gonna do some review questions. So what is a desirable outcome for the orientation stage of a nurse-patient relationship? The patient will demonstrate behaviors that indicate A, great sense of independence, B, rapport and trust with the nurse, C, self-responsibility and autonomy, D, resolution of feelings of transference. Usually, again, those questions, the way they're written, all of those answers are most likely going to be correct answers. So the way to look at it, we have to go back to the question and look for those keywords. So here we're asking about the nurse-patient relationship. So B, rapport and trust with the nurse would be the correct answer. A patient says, I've done a lot of cheating and manipulating in my relationships. Select a non-judgmental response by the nurse. A, how do you feel about that? B, it's good that you realize this. C, that's not a good way to behave. And D, have you outgrown the type of behavior? So obviously C and D are very judgmental, and we're asking about something that's not judgmental. It's good that you realize this. It's sort of put a judgment on it as well. A, how do you feel about this is an open-ended question. Patients admitting some type of behavior or confining to nurse. So that would be the correct answer. A person with a fear of heights drives across a high bridge. Which division of the autonomic nervous system is stimulated in response to this experience? A, limbic system, B, peripheral nervous system, C, sympathetic nervous system, and D, parasympathetic nervous system. So again, the key here is, is there a trigger? Is there a trigger that that maybe, are we looking at a trigger to or a fear, right, or a stressor? And it seems like there is a person with a fear of heights is driving over the bridge. So this person's probably not very relaxed. Their parasympathetic nervous system is not kicking in. They're probably pretty stressed. So the correct answer will be sympathetic nervous system. A soldier returns to the United States from active duty in a combat zone in Afghanistan. The soldier is diagnosed with post-traumatic stress disorder. The nurse's highest priority is to screen the soldier for which problem? A, major depressive disorder, B, bipolar disorder, C, schizophrenia, and D, dementia. So, we have this is a classic, situation. We're asking what people or patients with a post-traumatic stress disorder are in a high risk for, and they are in a high risk for depression. So major depressive disorder would be the correct answer. A soldier returned home from active duty and was diagnosed with PTSD. The soldier says, if there's a loud noise at night, I get under my bed because I think we're getting bombed. What type of experience has the soldier described? A, illusion, B, flashback, C, nightmare, and D, auditory hallucination. So that would be flashback. Patient is thinking that it's sort of a reliving that experience. A soldier served in Iraq in 2010. What is the most important for the nurse to screen for signs and symptoms of post-traumatic stress disorder? A, immediately upon return to United States. B, before departing Iraq to return to United States. C, 1 year after returning from Afghanistan or from Iraq. And then D, screening should be ongoing. So here the correct answer is ongoing, just because PTSD, as we mentioned, is not something that we typically cure completely. So it's something that the patients probably will have to deal with and get treated for the rest of his life. So ongoing screening is appropriate. An individual says to the nurse, I feel so stressed out lately. I think the stress is affecting my body also. Which somatic complaints are most likely to accompany this feeling? Select all that apply. A, headache, B, neck pain, C, insomnia, and D, anorexia. So that's going back to the stress response and going back to the science, the slide with person eating and not eating, to that article I'm referencing that I'm kind of asking you to review. Headache, absolutely. Neck pain from tension, yes. Insomnia and anorexia. So all of those answers will be correct. So all of those can be somatic complaints. So patients will complain of physical pain from stress. A nurse assesses the health status of a soldier returning from Afghanistan. Screening will be a priority for signs and symptoms of which health problem, and you have to select all that apply. A, schizophrenia, B, eating disorder, C, traumatic brain injury, D, seasonal affective disorder, and E, post-traumatic stress disorder. So post-traumatic stress disorder sort of seems like an easy and an obvious answer, which that would be a correct answer. But also when we talked about traumatic brain injury, it's a disease or a disorder that's often missed when patients are coming back from the war specifically. So we need to screen the patients for that, because sometimes if it wasn't, the trauma was not recent, it was an injury recently, it's easily missed. So traumatic brain injury is also something that we need to be screening patients for. Another one with application or how affecting how stress affects our body. A family member asks the nurse, do you think stress and physical illness are connected? Since my father's death, my mother has had shingles and the flu, but she's usually not one who gets sick. Which answer by the nurse best reflects current knowledge about long-term effects of stress? A, it is probably a coincidence. Emotions and physical responses travel on different tracks of the nervous system. B, you may be paying more attention to your mother since your father died and noticing more such things as minor illnesses. C, so far research on emotions or stress and becoming ill is unclear. We do not know for sure if there's a link. And then D, negative emotions and stress may interfere with the body's ability to protect itself and can increase the likelihood of infection. The correct answer is D. We know there's a link. It's immune response, it's inflammatory response that is in our bodies that makes us less immune and more prone to diseases when we're in stress, especially prolonged stress. Patient comes to clinic with superficial cuts on left wrist. The patient paces around the room, sobbing, but cringes when approached and responds to questions with only shrugs and monosyllables. Select the nurse's best initial statement to this patient. A, everything's going to be all right. You are here at the clinic and the staff will keep you safe. B, I see you're feeling upset. I'm going to stay with you to talk to you and help you feel better. C, you need to stop to cry. You need to try to stop crying so we can talk about your problems. And then D, let's set some guidelines and goals for your visit here. So correct answer for this one will be B. I see you're feeling upset. I'm going to stay and talk with you to help you feel better. D, let's set some guidelines and goals for your visit. It doesn't seem appropriate because there's nothing in the question tells us the patient's getting, out of the line or not following or has to be, sort of focus on her, be focused within the lines. C, you need to try to stop crying so we can talk about your problems. It's really not very therapeutic because we're telling the patient what they need to do. But acknowledging that the patient, anytime we're acknowledging patient's feelings, that's therapeutic. I see you're feeling upset. I'm going to stay with you. So I'm not acknowledging your emotions. I'm offering to be with you. So this is my therapeutic relationship to help you feel better. A patient comes to the crisis center saying, I'm in a terrible situation. I don't know what to do. The triage nurse can initially assume that the patient is A, suicidal, B, anxious and fearful, C, misperceiving reality, and then D, potentially homicidal. So we cannot be reading too much the question. So I'm in a terrible situation. I don't know what to do. Anxiety and fear would be your correct answers. There's nothing in the question that tells us the patient's suicidal. There's nothing that tells us that she's misperceiving reality, unless the question was telling us, I'm in a terrible situation. I see aliens chasing me, right? Then you would have a clue that she's misperceiving reality. Potentially homicidal would be, I maybe somebody's chasing me, or I need to fight or kill somebody. A woman says, I can't take it anymore. Last year my husband had an affair and now we don't communicate. 3 months ago I found a lump on my breast. Yesterday my daughter said she's quitting college. What is the nurse's priority assessment? A. Identifying measures useful to help improve the couple's communication. B. Discussing the patient's feelings about the possibility of having a mastectomy. C. Determining whether the husband is still engaged in an extramarital affair. And then D. Clarifying what the patient means by I can't take it anymore. So again, with this patient, we want to make sure we're screening for safety. With the first one, is it time right now to start improving communication between the couple? I don't think that's our role at all. Discussing patients' feel about possibility of having mastectomy, that's the good question. Is it our priority at this moment? The patient said that she found her lump 3 months ago. So again, this is not an prior right now. That's not what's causing that crisis. Determining whether the husband's still engaged, that's definitely is not a nurse's assessment or intervention. So clarifying what the patient means by I can't take it anymore is letting us know, will let us know, is the patient suicidal? What does it mean I can't take it anymore? So what was the alternative to it? So let's take the same question. And so we have the same, a woman says, I can't take it anymore. Last year, my husband had an affair and now we don't communicate. 3 months ago, I found a lump on my breast. Yesterday, my daughter said she's quitting college. If this person's immediate family is unable to provide sufficient support, the nurse should A. Suggest hospitalization for a short period. B. Ask what other relatives or friends are available for support. Tell the patients you must be strong. Don't let this crisis overwhelm you. And then D. Foster insight by relating the present situation to early situations involving loss. So correct answer for this one would be exploring options, right? Because the goal for us is to do at least invasive or at least the restraining options. So what we know from the sentences or from the question is that the patient does not have, so the immediate family is unable to provide help. So we would not want to admit the patient to hospital unless we sort of look at other options. Tell the patient be strong, don't let this crisis over you. Those patients in crisis cannot control crisis. They're actually very open to external help. Relating it to a previous situation is not going to be therapeutic. But when we ask to see if there's other relatives or friends that are available for support, so this question is clearly asking for support. If nobody is immediately available, then we would ask, is there anybody else to keep the patient in her environment? Which situation demonstrates the use of primary care related crisis intervention? A. Implementing suicide precautions for a patient with depression. B. Teaching stress reduction techniques to a beginning nursing student. C. Assessing coping strategies used by a patient who has attempted suicide. And then D. Referring a patient with schizophrenia to a partial hospitalization program. So the correct answer here would be, because again, we want to prevent things from happening. That's what you're going to do to prevent. Teaching stress reduction techniques to a beginning nursing student is appropriate intervention, primary intervention in this situation. A nurse assesses an adult experiencing a crisis. An appropriate question for the appropriate question for the nurse to ask to determine situational support is: A, has anything upsetting occurred in the past few days? B, who can be helpful to you during this time? C, how does this problem affect your life? D, what led you to seek help at this time? All of good answers, right? But we're assessing social support. So the only question that really is appropriate or applied to it is: who can be helpful to you during this time? A nurse interacts with a newly hospitalized patient. Select the nurse's comment that applies to the communication technique of offering self. A, I've also had traumatic life experiences. Maybe it would help if I told you about them. B, why do you think you had such a difficult time adjusting to this change in your life? C, I hope you feel better after getting accustomed to how this unit operates. And then D, I'd like to sit with you for a while to help you to get comfortable talking to me. So again, the question is offering self. We need to be present. Offering self, offering support is being present. Sharing nurses' traumatic experiences, that's one of the big no-nos. We shouldn't be talking about our personal life when the patient is in a crisis or is struggling. Asking the patient why they have hard time adjusting to the situation, it's not very therapeutic. And then asking about the unit, it's not really not applicable to the question. Patient tells the nurse, I don't think I will ever get out of here. Select the nurse's most therapeutic response. Don't talk that way. Of course you will leave here. B, keep up the good work and you certainly will. C, you don't think you're making progress? And then D, everyone feels that way sometimes. So the correct answer here is C. You don't think you're making progress? So assessing why is the patient thinking that they're never going to get out of here. A patient cries as the nurse explored the patient's relationship with deceased parent. The patient says, I shouldn't be crying like this. It happened a long time ago. Which response by the nurse will facilitate communication? Select all that apply. A, why do you think you are so upset? B, I can see that you feel sad about the situation. C, the loss of your parent is very painful for you. D, crying is a way of expressing the hurt you're experiencing. And E, let's talk about something else because the subject is upsetting you. So what will facilitate communication? So the key question is here, we want to continue to work with the patient. We don't want to shut down the conversation. We want to validate the patient's feelings and open, ask questions that are going to have the patient continue to communicate with us. I can see that you feel sad about the situation. The loss of your parent is very painful for you. Crying is a way of expressing the hurt you're experiencing. Asking why do you think you're so upset, it really is not therapeutic. It will ask a question, but it's not a question that's facilitates further communication with the patient. A patient approaches the nurse and impatiently blurts out, "You've got to help me. Something terrible is happening. My heart is pounding." The nurse responds, It's It's almost time for visiting hours. Let's get your hair combed. Which approach has the nurse used? A, bringing up irrelevant topic. B, responding to physical needs. C, addressing false cognitions. And D, focusing. So in this one, bringing up irrelevant topic, right? So the patient says that her heart is pounding, she has some somatic symptoms, and the patient says, let's brush your hair. A supervisor assigns a worker on a new project. The worker initially agrees, but she feels resentful. The next day, when asked about the project, the worker says, I've been working on other things. When asked 4 hours later, the worker says, someone else was using the copier, so I couldn't finish. The worker's behavior demonstrates A, acting out, B, projection, C, suppression, D, passive aggression. So this person is not coping appropriately. They're grieving. They're sort of are passive aggressive. So passive aggression is the correct answer. A patient is undergoing diagnostic tests. The patient says nothing's wrong with me except a stubborn chest cold. The spouse reports that the patient smokes, coughs daily, has recently lost 15 pounds, and is easily fatigued. Which defense mechanism is the patient using? A, displacement, B, regression, C, projection, and D, denial. So obviously there's more than just a stubborn cold. My best guess is the patient probably has lung cancer, but even without knowing the information, patient is minimizing. So he's in denial. He's minimizing his symptoms. Looks like the spouse sort of gives us a better picture. A patient who's preparing for surgery has moderate anxiety and is unable to understand preoperative information. Which nursing intervention is appropriate? A, reassure the patient that all nurses are skilled in providing post-operative care. B, describe the procedure again in a calm manner using simple language. C, tell the patient that the staff is prepared to promote recovery. And D, encourage the patient to express feelings to his or her family. So whoever's on and listening, does that sort of give you a little bit of an understanding or give a little bit of a picture of, what type of questions you might see, and then sort of an overview of what are the key words or key clues that you should be looking for? Ashley, Michelle, or Savannah?
Yes, thank you for narrowing that down a bit. That was helpful.
Yes. All right. Do you guys have any questions?
Do we need to know anything about the dissociative and the somatic? Like there was a worksheet that said to compare them, and I was having a hard time finding things that were similar between them.
So the only thing, so you need to know about somatic disorder. So somatic disorder, and I probably skipped that through the slides, but somatic disorder, yes. Be able to, and which pretty much all you need to do is if you have a patient that is experiencing physical pain that is not like they truly are experiencing physical pain, but it's because of psychological reasons. So there will be a perfect question for this would be somebody who presents to, frequently presents to the physician's room or physician's office, and they are continually complaining of uncontrolled pain. What is it, what's your suspect diagnosis? What type of disorder the patient might have, which would be somatic disorder.
Okay.
But you don't need to know the comparison.
Okay.
Any other questions? Ashley, Savannah?
So will we ever be asked like specific medications?
Not
No,
for
or
this. No, not for this. For this, I want you for this class and for this exam, I want you to know the classes of medication. So I want you to be able to tell me what are SSRIs, what are SNRIs, what are benzos.
And you said in class like knowing the symptoms and or like the side effects and like the nursing considerations for them.
Correct.
Was
So, so again, just knowing indications too. So know that benzos, the benzos work best, or the indications would be to give them short term for, situational anxiety. You don't want to be prescribing somebody and treating somebody's anxiety with Xanax. That's the
Right.
best. The way it works is, for a situation, not long term.
Okay. That was my only question that I really had going into this review, so.
All right. All right, if you guys don't have any other questions, please, if anything comes up, if you review it and again, have any specific questions, or you're not quite sure whether you should be, studying certain pieces or, I want you to read and you've read all of that. You did your, you did your lectures, you reviewed your modules, but I want you to focus on that information that's going to be crucial for the exam. So if you have any questions or concern about specific topics, please let me know.
Thank you.
You're very welcome. You guys have a wonderful night. Thank
You
you for
too.
coming.
Thank you.